Welcome to the Healing Grove podcast. I'm Dr. Kristin, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Welcome everyone to the Healing Grove podcast. I'm so excited to have this conversation today with my new friend, Dr. Sarah Myhill. Sarah, it's good to see you again.
I'm very happy to be here.
Thank you. You're so kind to have agreed to this. I just met Sarah a couple weeks ago, maybe a month ago, at a conference in London, and was blown away by her wisdom, her dedication to her patients, just her super whip smart brain, and just her penchant for being able to, and her passion for being able to kind of consolidate things into a way that's digestible and actionable, dare I say even maybe simple, for people to help themselves heal from complex chronic badness and also to prevent such badness. So I just, really grateful that you agreed to come share some of your pearls with us today.
My pleasure. My pleasure.
So, Sarah, why don't you start by giving us a little story of how you got here? I know your story because I've been reading your amazing book, which I'm going to plug right now, lest I forget to do it. This is your newest. You have several, but I think once people hear this conversation, they're going to want to run out and buy it. So tell us a little bit about what brought you to where you are as a practicing naturopathic physician, even though you were trained as a classical Western MD in Britain. Tell us sort of about your path and what brought you to this.
Okay. Well, I qualified as a conventional doctor in 1981. And soon after that, became pregnant. My daughter was born, and she had the most appalling colic. And I can remember my husband then saying, you're the effing doctor, you sort it out, and I had no idea why. Something made me give up dairy products. Her colic disappeared, as did my chronic rhinitis and asthma. And that was nowhere to be found in the medical textbooks. And I realized then, over 40 years ago, that the doctors were missing an awful lot. And that first awful lot was allergy. And then, of course, I went straight into general practice, and the most difficult questions that my patients were asking me were, why do I have arthritis? Why do I have migraine? Why do I have irritable bowel syndromes? And I also realized that doctors were not addressing that question either. They were not looking for disease causation. And that is because medical training has been taken over by big pharma, by the drug companies. And, drug company mantra is a patient cured is a customer lost. The last thing drug companies want are cures, because it stops people taking drugs. They want people on symptom suppressing medication for life. That causes escalating pathology like heart disease, cancer, and dementia. They don't want to address and that's where they make all their money. And so I started to incorporate ecological medicine, functional medicine, naturopathic medicine. It doesn't matter what you call it. It's all the same thing. It's all about asking the question, why? I started incorporating that into my general practice. And as a result of that, I had friends of patients, relatives of patients, friends of friends saying, oh, can you treat me like that? And so an independent practice evolved. And by the year 2000, I had developed enough contacts to be able to work independently. And that was very important to me at that time, because within the British NHS, I didn't have the clinical freedoms that I needed in order to be a good doctor. In fact, I had my wrists slapped because my prescribing budget was so low. And because I spent so little money on drugs, that meant I was a bad doctor. So in 2000, I went independent and developed things from there. But my real interest, my special interest, came with patients who had chronic fatigue syndromes and ME. And these patients are the worst treated people that we see in the whole of medicine. And I mean, even in the 1980s, when I was working, that clinical picture of TATT, tired all the time, represented up to 40%, nearly 40% of all clinical consultations. And doctors were not asking the question why, and they certainly had very few answers. So
hold on, 40% of your practice or 40% across the board in the NHS?
40% of general practice consultations were included that word fatigue. I'm tired. I'm not living up to my full potential. What's wrong? Now, you might get the basic blood test looking for maybe anemia or chronic, or cancer or some obvious pathology like that. But for many people, that was not the answer. So we have this large body of people who are occupying a huge amount of doctor time, and they are not getting the right answers. I mean, the doctors aren't even asking the right questions. So the question that I was really interested in is, what is the mechanism of fatigue syndromes? Why do people not have their full energy? Why are they not living up to their full potential? And that is the one on which I've published, on which I've written books, and continues to be my interest today. And I can tell you, I've never not been on a steep learning curve. I'm always learning new tricks of the trade. But I think I had the starting points.
Oh my gosh. Well, with those diagnoses, I mean, those are sort of the quintessential diagnoses of what and how and why in this person now is this syndrome developing. And I can imagine that and the reason I asked was that 40% of the NHS or 40% of your practice. I also found, because I was always interested in mechanisms and why, and looking for a root cause, even if it wasn't in the textbook, and being willing to sit with people, despite not knowing, I tended to attract larger than my fair share of those patients. Simply because I was the one willing to sit with them and ask the questions, even if I didn't have answers yet.
That's correct. And the first important lesson I learned in general practice is that patients didn't mind me saying, I don't know. I don't know why. And then they would go out and buy some books. I would phone a friend, and between us, we might discover another tool that was useful. So I've been discovering useful tools, over the last 40 years, and I'm trying to put them together in a way that everybody can access safely, cheaply, effectively, and improve their health. Because the awful thing is, this has got to be a grassroots revolution. We are not going to improve the health of the nation from the top downwards. It's got to be the bottom upwards. We can't do it from the top downwards because the doctors are trained by Big Pharma. So I see my role as an educator, as a teacher, and I am teaching people to become their own doctors, if you like, because nobody is going to be better motivated, better empowered, in a better place to monitor their condition than the person who's actually suffering. So that's when I appreciated that. That's when I started writing books, so that I could give people, as I call it, the rules of the game and the tools of the trade, so that they could do it themselves, so they could work out from first principles what is wrong. And the tools of the trade that I like to use, they've got to be effective, they've got to be safe, they've got to be available to everybody. And I like it when they multitask, when they do more than one job. They help to detox, and they help energy delivery mechanisms, and they're anti-inflammatory, and they can be easily incorporated into one's life. Because I'm asking people to do difficult things, change their diet, be disciplined about their sleep, whatever, take supplements. And these have all got to be things that are doable. And, one of the problems for many of my patients, and you've probably heard this joke, so forgive me, but maybe your listeners haven't, are what I call the PBs. Now, this is a phrase that's been incorporated into my vocabulary, and it arose from a newspaper article I read some years ago about a merchant bank who wanted to target their wealthiest customers for a new investment scheme. So the letter was prepared, it went down to the printing department, but the minion in the printing department forgot to press the mail merge button at the last moment. So these, a personalized letter should have gone out, but instead a letter that went out that opened up, "Dear rich bastards." So that's been subsumed into my language. So not many of my patients are RBs, not many are rich bastards. Most of them are PBs. They're poor bastards because they can't work. They can't work because they have debilitating fatigue or pain or whatever. So these interventions have to suit my PBs. They have to be affordable. And now I find that my standard workup to treating fatigues, we don't need to spend lots of money on tests because I know what the answers are going to be. So the basic workup is available to all. I don't say it's cheap, but it's very doable for the vast majority of people, and the majority of people get good results. And the important thing about these techniques is not only are they a very good way to treat the chronic fatigue and the inflammation or whatever else they have, but they are also the starting point to not get heart disease, to not get cancer, to not get dementia. Because I want everybody to live their lives to their full potential in terms of the quality of their life and the quality of their life. So I want to live like the old boy I look after, Tony, who lives in my granny flat, who, as I say, was 101 in July. He's living at a very high level, and then one day he'll just drop off his perch like that. But he has no pathology, he has no heart disease, he has no cancer, he has no dementia, he's as sharp as a tack, he's full of anecdotes. And that's how I want to be when I get to 101. And that's how I want my friends, my family, my patients, my neighbors to be when they get to 101 as well.
Does anything about his current vitality have to do with the fact that he's living in your granny flat? Like, are you in charge of feeding him? And
Correct. Correct. It's all about the diet. And even Tony himself says this. Yes, of course, I give him some supplements. But getting well is like building a house. And the foundation stones of that house is the diet. And if you're not prepared to do the diet, you can forget about the rest. The diet is absolutely crucial. I mean, I run training weekends at my home here, and we have 12 people at a time, and I talk for 3 days and they talk for 3 days as well, and we have great fun. But I bet we spend 50% of the time talking about food. What are the best foods, how to find them, how to access them, how to cook them, how to enjoy them to their best, because the diet is absolutely central. And I read in the paper the other day that in Western countries, 70% of people consume processed foods. That's where they get their calories from. And that is an absolute disaster for health. It's driving our epidemics of obesity, of diabetes, of mental disease. We had a consultant psychiatrist coming, wonderful girl, and she consumes a pure carnivore diet and has done for 4 years. And she says that is the starting point to treat people with serious mental disorders, because you can cure them. You're not managing them, you can cure them. You're restoring them to good mental health when their moods are stable, and they are thinking straight and they are functioning to a high level. So the diet is absolutely crucial.
All right, I'm going to pause you on that, because I know some people's heads just exploded when they heard that a carnivore-based diet is the answer to, mental issues or brain issues. So you and I both know the answer to this, but just will you spell it out for the listeners why that might solve people's problems to be eating purely meat?
Okay. Well, with my patients, I know I don't go in head first with the carnivore diet. I start off with the paleo ketogenic diet. We'll come on to what that is. But the point is, food drives much pathology, possibly for reasons of allergy. And the commonest allergens are to the gluten, grains, and to the dairy products, possibly for reasons of toxicity. And many vegetables and plants and seeds are naturally toxic with lectins, but often because they are high in carbohydrates. And one of the problems with carbohydrates is they lead to what I call the upper fermenting gut, and that drives so much pathology. Now, let me explain that, because if you guys can get your head around this, then you are doing incredibly well. So the normal gut should be, humans are omnivores. We can eat meats and we can eat vegetables. And the normal gut, upper gut, the first 22 odd foot of gut, should be a carnivorous gut, like Nancy's gut. She eats a pure meat diet. And the upper gut is there to deal with meats and with fats and yes, some starches. And essentially it's sterile. It's sterilized by stomach acid. And we need an acid stomach to get the pancreatic enzymes and bile salts and enzymes from the small intestine in order to digest those foods. And then the lower gut, the last 4 or 5 foot of gut, that's where the large bowel is, and that's where our microbiome is. And that should be a vegetarian gut for the business of fermenting fiber, programming the immune system, fermenting to produce neurotransmitters, vitamins, and other such things. Now, things go wrong when we eat a high carbohydrate diet, and we overwhelm the ability of the upper gut to be sterile, to deal with that. And as soon as you cannot sterilize your upper gut, then the microbes move in, the bacteria move in, the fungi move in, and they start to ferment those foods. And as soon as you ferment the foods, you create a whole host of problems. First of all, the products of fermentation. So if you ate, a pound of grapes, for example, that's yeast with sugar, and yeast ferments sugar, produce alcohol. It's called the auto-brewery syndrome, and you produce significant amounts of alcohol. In the 1990s, Biolab in London used to do a gut fermentation test where they would measure blood alcohol and sugar levels before and after such a meal. Sometimes you get a blood alcohol up to 90 milligrams per deciliter, which is, not far off drunk driving limits. So if I had to have, if I had a glass of wine for breakfast, guess what? I wouldn't function in the day. But by having a breakfast of fruit juice, toast, cereals, effectively you're having half a glass of wine for breakfast. And guess what? You're going to be fatigued and foggy brained. And it's not just alcohol that's produced. D-lactate, hydrogen sulfide, ammoniacal compounds, these are all toxic. These all can result in foggy brain and, of course, fatigue. So that's just one problem. The second problem is the microbes themselves. And if you want to look at life from the point of view of a microbe, it doesn't want anybody else in its ecological space. It wants that ecological space for itself. So all microbes produce toxins, to keep other bugs at bay. I mean, the one we all know about is penicillin. Penicillin is produced by yeast, and the idea of penicillin is to kill bacteria so they can't move in on the ecological space of that fungus. But all yeast produce mycotoxins, all bacteria produce endotoxins of some description, and these are also toxic to the human being. They also poison us. So that's a big issue. A third issue is that, we are taught at medical school, yes, the gut is full of bacteria, and there they remain. And we now know that's not true. We now know these microbes very easily get from the gut into the bloodstream. In fact, and that is called microbial translocation. Now, if these microbes get into the bloodstream and circulate, they get stuck in the body at distal sites. And where they get stuck, they drive pathology. So in the joints, they drive arthritis, rheumatoid arthritis, psoriatic arthritis, inflammatory arthritis. In the lungs, they drive intrinsic asthma. In the gut, they drive inflammatory bowel disease. In the skin, they drive maybe chronic urticaria and eczema. In the brain, they drive psychosis. Fascinating work done by Nishihara has demonstrated if you've got fermenting microbes in the gut, you have those same microbes in the brain with the potential to ferment out neurotransmitters like adrenaline and noradrenaline into LSD and amphetamine-like substances. So in addition to all, which of course would explain psychosis. And in addition to that, if your upper gut is full of microbes, then when you start to take, nourishing foods and vitamins and minerals, the microbes are the first in the queue. And they say, oh, yum, 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 I like this. You're just feeding the microbes. You make the problem worse. And those nutrients might not even get into your body because, say, they're being mopped up by all these fungi and all these bacteria. So the upper fermenting gut is a big problem, and that's why carbohydrates in the diet are such an issue. And the starting point to treat anybody is a paleo-ketogenic diet. Paleo, because dairy products and gluten grains are major allergens, and ketogenic because it's low carbohydrate. And the first way you go about treating the upper fermenting gut is you stop feeding it. Stop feeding it with processed foods, with starches, with sugars, with carbohydrates, which they readily ferment. So that is, and again, whenever I have a difficult question, somebody says, why are you doing this or why are you doing that? I always go back to first principles of evolutionary biology. And the paleo-ketogenic diet is what primitive woman consumed. And another important aspect about the paleo-ketogenic diet is primitive women didn't eat the same foods all year round. It wasn't the same breakfast, the same lunch, and the same supper. It varied. It varied with the seasons. Now, in the autumn, of course, there would have been a windfall of fruit, of nuts, of berries, of seeds, of root vegetables, of pulses, of grains. And those are all carbohydrate-containing foods. And when you start eating carbohydrates, it switches on a carbohydrate addiction gene, and we eat them in an addictive way, i.e. we can't stop eating them. And primitive woman would have done precisely that. And that carries huge evolutionary advantage because she'd have eaten everything she could lay her hands on. She'd have got fat, And fat is survival value for the winter. So our primitive woman wanted to be plump at the end of the autumn because it's insulation and, of course, it's her own personal pantry. And that would have allowed her to survive the winter when food was scarce. And in the winter, yes, she'd have gone out, she'd done a bit of hunting, and ditto in the spring, and that would have kept her going. And then, of course, in the summer, she'd be growing foods again, foods would be available, and round we would go, i.e. the diet would be constantly changing. And that is also very good for our microbiome. That's the last kind of 4 or 5 foot of gut where yes, we do have a fermenting gut. Because we don't know much about the microbiome, but what we do know is that the more diverse it is, then the healthier we are. And in the microbiome, there is a predator-prey relationship between the bacteria, between the yeast, between the viruses there, because we do have viruses in our microbiome. It makes out about 15%. We have a predator-prey relationship. And just like in the natural world, we have a predator-prey relationship. And that prey, the more diverse the foods you can consume, then the more diverse the predators, the more diverse the eaters. So just eating a varied diet throughout the year and throughout the week is going to be very helpful to our microbiome. As a rough rule of thumb, we want to be consuming at least 30 different foods every week. And that food can be a spice, and it can be a herb, it can be something we add to our foods to make them taste good. It can be different seeds, different nuts, different meats, or whatever. And that is the basis of good health. I say that paleo ketogenic diet.
Beautiful. Do you recommend, getting back to first principles, that people drop the keto part in the late summer, early fall, just to kind of mimic this thing that our ancestors did with carbs?
Well, that's not going to do any harm for a short window of time. I mean, in order to drive pathology like heart disease, like cancer, like dementia, you've got to be eating carbohydrates for decades. In your as a child, in your 20s, your 30s, because guess what? We don't get those diseases until we're in our 60s and our 70s and our 80s. So it's decades of consuming a high carbohydrate diet drives those pathologies. So a short window of time in the autumn or at the weekend when you slip off the wagon is no problem at all. But I like people to be in ketosis about once a day. And, I'm a gardener, and at this time of year, guess what? I'm eating potatoes. I've got chips for my supper. Not a lot of them, but chips, and I will have some meat, some calabrese from the garden, and pudding will be berries with some coconut milk. And I shall much look forward to it and enjoy it. So it is a very good diet. In fact, when I run these weekends, obviously I feed people as well. So they come on the Thursday evening and we eat, guess what? A paleo ketogenic diet all weekend. And by the Sunday afternoon, most people are in ketosis. Most people are blowing ketones when we measure their levels of ketones on a ketone breath meter. So it's not difficult to get into ketosis. It's not an addictive diet. So you have your food, you're satisfied with what you've got, and you don't have to go out and have something sweet in order to feel satisfied. So it turns off those cravings, and it is, I say, the evolutionary correct diet.
Yeah, it's a species appropriate is what I like to call it. And I use the same diet for my patients too, and myself love it. And I'm amazed at how many kids come to me. I see a lot of kids with seizures who've been treated in these hospitals and who've been sometimes started on a ketogenic diet, where the physicians and team just insist this must be an in-hospital ketogenic start. Like, it's so unsafe to do it. It's ridiculous. I'm like, it's our native diet. What do you mean you can't do it outside of a hospital? It's like birth. Birth also probably shouldn't happen in hospitals unless there's some really like, these are natural, healthy things to eat. Correct. Yeah.
And you've probably seen the film starring Meryl Streep, First Do No Harm, which tells exactly that story of the struggles of a mum who just wanted the best for her epileptic child, and the barriers that were put in her way to prevent her, because a ketogenic diet is almost seen as a form of child abuse. I mean, it's complete nonsense. The real child abuse is rearing our kids who are sugar addicts and giving them sweets and candies and chocolate and processed food. That is the child abuse. That's where the child abuse lies.
Yeah. Starting their upper fermenting guts from an early age. So I think a lot of people would be interested to know, well, what do I I don't know how many I don't know if my carb amount is too much. I don't know if I have symptoms of an upper fermenting gut. Like, how do people self-identify as someone who might need to look a little closer at your protocols?
Okay. Well, you can't beat an objective test. And I like people to have a ketone breath meter, something like an ACE track, which is sitting on my desk somewhere. To measure ketones, that's an ACE track, and you blow into it and it measures the ketones in your breath. And because everybody gets into ketosis at a different level. So if you've got a bloke who's physically active, who's using a lot of calories in a day, they will be able to consume a lot more carbohydrates and burn them off and remain in ketosis than somebody who's maybe sick and lying in bed and can't manage the physical activity. So everybody is different. And this is the joy of having a test, because it's objective. It also stops patients coming to you and saying, I eat this and I eat that, and have I done it well enough? And that's not your job. That's not my job. My job is to point them in the right direction so they can manage it themselves. And once they can manage it themselves by measuring their own ketones, then they can help their family and their friends and their neighbors. Because, as I say, this has to be a grassroots revolution. And actually measuring the ketones in the breath is an incredibly useful test, because it tells you when you've done the diet well enough. Now, before I had a ketone breath meter, I was very strict about it. Since having that, I found I can relax my diet a lot, because I'm lucky. I do like exercise. I like to go for a walk. I like to garden, and I can get away with eating more carbohydrates than I thought I could, but still remain sharp, sleep well, have the physical and mental energy to do all the things that I want to do.
So those are maybe some places to start in terms of someone who's wondering, could this benefit me? If you're not sleeping well, if you're not feeling mentally sharp. I see a lot of people who fall asleep after meals. In America, we call it the food coma. It's very common. Now I'm hearing it's not just that your blood sugar is crashed and that you have no ketones and you're not metabolically flexible enough to make them. It's that you may have produced a lot of alcohol with the intake of grains and fruits and other things. So people who might want to try this, maybe you're wondering if it's for you. If you're tired all the time, if you're, what is it, TATT?
Yeah.
If you have bloating and gas, I was taught in medical school that it's normal for humans to produce 14 liters of gas a day. I think when I'm in ketosis, I don't fart. Like, I don't create that same amount of gas because I'm just not putting in the food sources that would create that.
Well, let's just clarify that then, because when you're eating a low carbohydrate diet, it's gas production in the upper gut that's important, because it causes burping, and we're producing gases which like carbon dioxide. Obviously, if yeast ferment sugar, you produce carbon dioxide. Now, when you ferment fiber in the large bowel, and guess what, fiber gets the thumbs up, then that will ferment to produce some hydrogen and methane, and yes, you will fart a bit. Now, the point here is that hydrogen and methane are odorless. They don't smell. So if you do fart a bit, it's not offensive. If you are farting and it's offensive, then that's because you are fermenting protein. And you're fermenting protein either because you've got a short gut transit time and you're washing protein into your lower bowel, or you're consuming too much protein, or you haven't got the digestive enzymes to deal with protein. So yes, the answer is I do fart a bit, but it doesn't clear the room. It's odorless. I don't burp, and that is the normal state of affairs. But some people are very unfortunate, and they're fermenting the upper gut with anaerobic bacteria as well, and that can cause huge bloating, and that can be very uncomfortable, and the distension is painful. But the treatment is the same. Starve out the little wretches with a low carbohydrate diet. And then the other two tools I like to use is you kill them with vitamin C and you kill them with iodine. Now, vitamin C and iodine are my two favorite multitasking tools because they do so much good for our health. Now, we all need to take extra vitamin C. And the reason for that is we can't make our own vitamin C. So my little dog, Nancy, who's on my shoulder there, she can make her own vitamin C from protein. From protein, gluconeogenesis to sugar, and then from sugar, she can make vitamin C. And so can all other mammals in the mammal world, except guinea pigs and dry-nosed primates. So all mammals can make their own vitamin C, except humans and a few others. So that's why vitamin C is a vitamin for us, but not for those animals. Now, given and those animals, those mammals, they can gear up the amount of vitamin C they need to deal with demand. So if we have an upper fermenting gut, or if we have a chronic infection, or even an acute infection, we need lots of vitamin C. Goats, for example, can synthesize up to 15,000 milligrams of vitamin C in 24 hours. That's 15 grams of vitamin C. And that's part of the reason why goats are so incredibly healthy and are rarely ill. So can horses, so can cows, so can sheep.
Why did we get short end of the vitamin C stick? What happened there? What evolution?
Very good. It's a very, very good question. Nobody really knows. But the point here is that evolution doesn't care about us once we've had our children, and so we're able to consume sufficient vitamin C in natural foods to get us to childbearing age and rearing them, and then we fell off the perch. So, but I'm old. I'm on the evolutionary scrap heap. But guess what? I am enjoying life, and I do want to live life to its full potential. So I take 5 grams of vitamin C every day. And that cleans up any upper fermenting gut you may have, because vitamin C contact kills all microbes. But it's vital for good antioxidant status. It helps us to detox heavy metals. It keeps our tissues soft. It keeps our eyes soft, so we don't need to wear spectacles as we get old. I might have to give you the glasses lecture, Kristin, at the end of this. So it does lots of good things as well, and it protects us from infection. And so I like to take 5 grams of vitamin C every day. And then at the end of the day, 3 drops of Lugol's iodine in a glass of water, because everybody is iodine deficient. And iodine is incredibly cheap, and it's another one of my favorite multitasking tools. Again, the commonest cause of mental deficiency in the world today is iodine deficiency. Obviously, it's essential for the thyroid gland, but you can cure fibrocystic disease of the breast with iodine. Fibrocystic disease of the breast is symptomatic of iodine deficiency. It's essential to make oxytocin, which is the love hormone, which is what all our autistic and on the spectrum kids are lacking. It's essential for muscles. You can't make strong muscles without iodine. It's antidysrhythmic in the heart. And guess what? We're seeing epidemics of atrial fibrillation. Of course, it's essential for the thyroid, and we're seeing epidemics of the underactive thyroid. So it's a fabulous multitasking tool. And 3 drops of Lugol's iodine, that's my Lugol's iodine. A bottle like that costs about £7, and that will last you weeks and weeks and weeks and weeks. All my PBs can stretch to that. And those 2 interventions, combined with a paleo-ketogenic diet, is for most all they need to do to deal with the upper fermenting gut. And once you've dealt with that, you have also dealt with and prevented a whole range of other pathology.
Okay, so I have a couple questions just for clarification. So what percentage of Lugol's are you using? Because I know it comes in different concentrations.
That's 15% of Lugol's iodine. 3 drops supplies about 50 milligrams.
So you're shooting for 50 milligrams a day. So would iodoral, which comes in a 50 milligram tablet, be acceptable?
Ideal.
Okay, so any form of iodine, as long as you're getting
yes, as long as it's got elemental iodine. I mean, Lugol's iodine has been developed over decades, and it's the best and most bioavailable form of iodine, and it's dirt cheap. So let's use Lugol's iodine or iodoral. Iodoral is Lugol's iodine in a pill form.
Okay, so if you're using a smaller concentration, you just have to change. You have to do the math to get 50 milligrams of iodine a day. Great.
Correct.
In terms of the vitamin C, is there a formulation? A lot of people are talking about liposomal vitamin C. Does that actually get to the gut, or does that just get absorbed in the bloodstream and not deal with the bugs?
I think liposomal vitamin C is a bit of a con. And when it first came out, I got in touch with the manufacturer and said, what is the basis? What's the scientific basis for using liposomal vitamin C instead of ordinary vitamin C? Because, of course, it's very expensive. They said we've done the studies. What study? The study was 2 people. They both took 35 grams of vitamin C. One was liposomal, one was just good old ascorbic acid. They both had diarrhea, of course, with that dose. The levels in the blood with liposomal were marginally higher than ascorbic acid. So I got back to them and said, you've got to be joking. You've got to have better evidence base than that, at which point they cut off communication with me. So wow. I just use boring old, ascorbic acid. It's the cheapest. It's the best. It's the form of vitamin C that Frederick Klenner and Robert Cathcart were using in the 1940s and the 1950s, the 1960s, and the 1970s to cure polio, to treat peritonitis, to treat Epstein-Barr virus infections and pneumonias and much more. It's a proven efficacy, it's bioidentical, and it's as cheap as chips. So I just use ascorbic acid.
Beautiful. And that dose of 5 grams, is that all at once, or is that something you work up to or taken in divided doses?
When I'm treating people, you always start low and go slow. So some people just don't tolerate the ascorbic acid. Some prefer it in a neutral form, in which case we can add some magnesium carbonate to make it a neutral form. Some people are, and this is rare, some people are allergic to the ascorbic acid because it's derived from corn. It's a corn ferment. And the very corn allergic patients will react to the little bit of corn that remains. But largely speaking, it's well tolerated. So I start off with maybe 0.5 gram a day, build up slowly to 5 grams. Some people need 6 grams, some people need 7 grams. We adjust the dose. Now, getting to the bowel tolerance level of vitamin C is a really important thing to get our heads around, because the more vitamin C we can take, the healthier we can be. The body will take whatever vitamin C it needs for the business of dealing with chronic infection, dealing with the upper fermenting gut, good antioxidant status, and so on. And the rest will remain in the gut. Now, that vitamin C that remains in the gut will eventually start to kill some of the friendly microbes in the large bowel. They then get fermented by other friendly microbes, and you produce foul-smelling wind or sometimes diarrhea. And that is undesirable. We don't want that. So when you start off taking vitamin C, you gradually increase the dose until you start to get foul-smelling wind, or maybe a rumble in the tummy, or maybe a loose bowel motion, and then you reduce the dose a little bit. And that's a very useful thing to do, because if your bowel tolerance is very high, if you need 15 or 20 or 25 grams to achieve that, then that tells us that you're not a well person, or let's put it, you're less well than you could be. So, I'm slightly ashamed to tell you this story, but when I started getting interested in vitamin C, of course, I'm always the first guinea pig. I always do these things on me before I try it on anybody else. And to my slight shock and horror, I got up to 35 grams a day before I got to bowel tolerance. Now, at that point in my evolution, I was doing low allergy diets because I'm allergic, but I hadn't got the upper fermenting gut story. I wasn't doing very low carbohydrate diets. And I obviously had an upper fermenting gut. And much of that vitamin C was being used up to kill off those microbes. So once I worked it out what was going on, of course, then I went keto, the dose of vitamin C came down, and now I take about 5 grams a day. And if I take more than that, then I get foul smelling wind. So I know I've just about arrived.
In other words, you really had a deficit when you started and needed that much to get to the place where your body was ready to give it to the lower bowel and then give you symptoms. And now you're much healthier. You've sorted out your upper fermenting gut, and you are only needing 5 grams a day. So that 5 grams may not be the end dose for someone else, right? It could be that they need 1 gram a day or 10 grams a day, but they need to find out.
Correct. And everybody's individual. That's why there is not a prescribed dose. There are what I call the rules of the game, and that individual sorts out what is correct for them. And everybody is different.
Awesome. So aside from those two things and the PK diet, the paleo keto diet, are there any other major tools in your toolbox that you feel like everybody in the known universe should know about?
Correct. There are lots. And the most important thing that we have in our lives is energy. And that's my special interest, looking at energy delivery mechanisms. And the analogy that I like to use is the car analogy, because everybody gets it. Even I'm sorry it's going dark here. The clocks have gone back, and I haven't put the lights on, so I hope you can still see me. But it's all about energy delivery mechanisms. And so, using the car analogy, for your car to go, you've got to have the right fuel in the tank. And that's all about what we've talked about. It's paleo ketogenic diet and sorting out the upper fermenting gut, because the perfect fuel for our car engines are ketones. Then we've got to have good oxygen delivery. And guess what? We've got to have oxygen going to our car. If you cut off the oxygen, then the car's going to come to a halt very quickly. Even I know that. Then we have to have the mitochondrial engine. And it's mitochondria, which is my special area of interest. And what our mitochondrial engines do is they take fuel from the bloodstream in the form of ketones. They burn that fuel in the presence of oxygen to generate energy. And the energy molecule in the body is ATP. And we can talk about mitochondrial function. And then we need the control mechanisms. And for our mitochondria to go at the right speed, we need thyroid hormones. And the underactive thyroid is extremely common, especially in my fatigue syndrome patients. And then we need the adrenal gearbox. And the adrenal gearbox allows us to very closely match energy demands to energy delivery, because we can't afford to waste energy. Energy wasted is massive evolutionary disadvantage. So, when we're stressed and we've got to perform, then we need the adrenal hormones, the adrenaline and the cortisol to gear up energy delivery so we can perform. But we can't do that all the time at a high level. Then we need to rest after. And when we rest after, then the levels of adrenaline and cortisol come down. And so they're low at night while we're sleeping and healing and repairing, and they're high in the morning to get us going and fired up for the day. So it's attention to those 5 factors that I'm always thinking about with my fatigue syndrome patients. But attention to those 5 factors the athletes like to know about, because you can improve athletic performance. And so the top athletes, many of them, eat, especially the endurance athletes, they function much better on a ketogenic diet. In fact, the world record for the furthest distance run in 172 miles in 24 hours is held by Mike Morton, keto-adapted athlete, and in 24 hours he ran 172 miles. And he didn't need to eat. He didn't need to have chocolate drops and jelly babies and sugar drinks to keep going. He was running on fat. Yes, he needed water and electrolytes, but he didn't need to eat. So it just illustrates the point that you can improve endurance performance with a ketogenic diet. And then, of course, there's oxygen. We need the right breathing techniques so we get good oxygen delivery to the tissues. And then, of course, the mitochondria need the raw materials to work. So the athletes are interested in this. And this is the starting point to treat heart disease. In heart failure, you've got poor energy delivery to the heart, and that's largely a mitochondrial disorder. In dementia, you've got poor energy delivery mechanisms to the brain, and you can reverse dementia with a ketogenic diet and attention to all these issues. Cancer, the difference between cancerous cells and normal cells is the fuel on which they run. Cancer cells can only run on sugars and carbohydrates and a little bit of 1 amino acid glutamine, whereas normal cells can happily run on ketones. So, if you've got any of those pathologies, the starting point to treat is the same. Address the energy delivery mechanisms, those 5 big players.
Or if you want to prevent any of those things, right?
Absolutely. And guess what? I want to prevent those things. I'm enjoying life too much to not want to prevent them.
Right. I thought maybe you were going to mention methylene blue. Methylene blue is one of the kind of on my learning edge for the last year, and I know you have a lot of experience with it. Would you say just a few words about what you use that for?
Okay, well, I'm seeing patients who have chronic fatigue syndrome, which is all about poor energy delivery mechanisms. Some of them have ME, and with ME, there's inflammation when the immune system is activated. And inflammation causes lots of nasty symptoms, and as I call it, it kicks a hole in the energy bucket. Now, methylene blue impacts on both sides. It impacts on energy delivery mechanisms, and it impacts on chronic inflammation. Now, it impacts on energy delivery mechanisms because it's a very good receiver and donor of electrons. It reduces the friction in mitochondria. It allows mitochondria to work more efficiently. So it's going to be good for energy delivery mechanisms. And then when it comes to inflammation, many of my ME patients have chronic infection. And if you've got one chronic infection, then you're going to have others, because if you've got one chronic infection because your immune system isn't working well, and if your immune system isn't working well, you're going to get others as well. And that's all been compounded by the recent, COVID pandemic. I call it plandemic deliberately, because one of the problems with COVID is it unmasks other infections that were hitherto being kept under control. So as you know, 90% of us will test positive for Epstein-Barr virus. We've all got Epstein-Barr virus in our tissues. We've all got human endogenous retroviruses in our tissues. But if the immune system's got plenty of energy and good raw materials, it will keep those infections at bay. But if COVID destroys our immunity, or the COVID vaccine destroys our immunity, or our energy delivery mechanisms are impaired, then those infections can flare up. So I often end up with patients who've got a cocktail infections. They've got long COVID, they've got Epstein-Barr activation, maybe a bit of Lyme disease, maybe mycoplasma, maybe retroviruses, whatever, maybe fungal issues as well. And the joy about methylene blue, it's a very good broad spectrum antimicrobial, and it's very good at reducing the total infectious load. And another joy of methylene blue is it's very inexpensive, it's very cheap, it's extremely safe, you don't need a prescription, anybody can access it, and it's become one of my favorite multitasking tools. Now, just a little clinical tip here, and I'll send you my handout, is when you methylene blue is blue. I mean, it's seriously blue. It's like drinking blue ink. And if you drink that, your tongue goes blue, your teeth go blue, your lips go blue, it's enough to frighten the horses. So a very useful clinical clue is you get your solution of methylene blue, and I'll tell you how to make that up in a bit, and put a bit of ascorbic acid in it. So I put my daily dose of ascorbic acid in my methylene blue. I put, 5 grams in there and let it stand for about an hour. And the ascorbic acid slowly reacts with the methylene blue to turn it into leucomethylene blue, white methylene blue, which doesn't stay in your teeth, which doesn't stay in your tongue, which doesn't frighten the horses. And in the body, methylene blue swaps between leucomethylene blue and methylene blue as it donates and receives electrons. So it's very physiological. You can easily incorporate it into your life, and it improves energy delivery mechanisms as well as reducing the infectious load. So it's rapidly become one of my favorite multitasking tools.
Fascinating. So its efficacy is not really reliant upon whether it's an oxidizer or an antioxidant in terms of its ability to pull electrons, give electrons. It's really about, it's a flexible player, and it can kind of go where it's needed and do what's needed in that moment.
Absolutely. And and again, it's remarkably safe. Now, the only ride I have to mention, it is a very mild monoamine oxidase inhibitor, which may be part of the reason why it's good for mood. But you have to be careful, a little bit careful with vasoactive amines, careful with things like alcohol, fermented foods, broad beans, pickled herrings, things like that. But of course, guess what? I put all those things to the test. I take methylene blue, and I've eaten those foods, and so far I haven't had any trouble. I haven't had the headache, haven't had high blood pressure with it. So it is a very weak methylene, very weak MAOI, but you just need to bear that in mind when you're dosing with it.
And you need also not to be on any MAOIs, right, for depression. Some people are still on those older drugs.
I know. And again, you see, the MAOIs and the SSRIs and the anticholinergics, they are not treating the root cause of depression. It's really just symptom suppression. And many people who are taking those antidepressants say they feel emotionally numb. It's as if they don't care anymore. And that's what those drugs do. They kind of almost, they stop them caring. And that's not a good thing to be in either. So improving energy delivery mechanisms, not only is it good for the foggy brain, it's very good for depression and low mood, because I think those symptoms of depression, anxiety, low mood are the symptoms that the brain gives you to stop you from spending energy. I've missed out this really important concept, which I'll just explain quickly. We all have a certain bucket of energy to spend in a day. If we spend more energy than we have in that bucket, then we will die. We will die because we don't have energy for the heart, for the brain. We don't have energy to stay alive. So to stop us spending all the energy we have in that bucket, the brain and the body give us symptoms. So if that's my energy bucket, and if I start to get close to my energy bucket, then the body will give me symptoms of physical fatigue, of muscle pain, of the sensation of no stamina, of exhaustion. It'll give us mental symptoms of foggy brain, procrastination, can't think clearly, poor short-term memory. But the brain also knows that we're running out of energy, and the brain will give us symptoms to stop us spending energy. And those are symptoms like depression. Because when you're depressed, you don't want to go out and do podcasts and be jolly and giggly and silly and be sociable. You just want to curl up in a chair and be antisocial. That's what depression is all about. So by improving energy delivery mechanisms, you can help so many of these psychological and psychiatric symptoms like depression, anxiety, and stress. And if I could give somebody infinite energy. So they never needed to sleep. They could do it all. They could look after the family. They could hold down a big job. They could go out and socialize, never out of it, and they'd have a lovely time. And the awful thing is that's what drugs do. That's what drugs do, like cocaine and ecstasy and amphetamine. They give us the false impression that we've got infinite energy. And I think that's what kills people with these drugs, because they miss the symptoms that tell them that they're running out of energy, and they're running out of energy, and suddenly they spend too much, and they're going to go down with a bang, aren't they, when they spend too much? So that is my guess, is that the mechanism by which those drugs kill people all has to do with energy delivery.
Wow. I think that perspective is such a useful one. And I think it's missed so often because, in our society, we're so geared to kind of produce, go, mask the symptoms with ibuprofen or Tylenol or caffeine, right? People are just flogging themselves with these things to keep going. And it's leading to a lot of downstream badness.
There's no question about that. In fact, a friend of mine, he has a lovely saying. He says, there are two things that kill people: addiction and ignorance. And I think it's absolutely spot on.
Amazing. Well, this has been such an awesome conversation. I'm aware of Tony next door who needs to but I have one more question for you. And you really piqued my interest with the eyeglasses thing, because, I'd love not to have to. Is there hope for me? Can I reverse this?
Absolutely. Absolutely. Okay. So in order to explain where, the reason for the need for glasses, we first have to ask, how do eyes work? How do we focus light on the eye? Now, we're taught at medical school that if we're looking at something close to, then the lens is round and fat in order to focus the light. And if we're looking at something far away, the light's coming in almost parallel, and the lens has to thin. It flattens in order to focus light at the back of the eye. But that's not the whole story. In addition to that, the eyeball itself changes shape. So when we're looking at something in the distance, the eyeball becomes spherical like a golf ball, and the retina comes forward to facilitate focusing. By contrast, when we're looking at something close to, the eyeball elongates like an egg in order that the retina comes back to assist focusing. So for that to happen, we've got to have, first of all, an eyeball that is soft. And secondly, we have to have muscles in the eye which are strong. Because the muscles that change the shape of the lens and also change the shape of the size of the pupil in response to light, they are embedded in the eyeball. So as the lens gets fatter, so the eyeball lengthens for near to vision, and conversely, as the lens flattens and becomes spherical, that's all to do with the muscles of the eye that achieve those changes. So in order that we can see perfectly through into old age, the first thing you have to do is keep the tissues of the eye soft. Now, the main thing that hardens the tissues of the eye is sugar. This is why diabetics get diabetic eye disease, because they're running high blood sugar, and that stiffens the connective tissue of the eyeball. And the second thing to soften it is vitamin C. Vitamin C protects against the free radical damage that makes the whole of the tissues of the eye hard and resilient. And the second thing we have to do is keep the muscles of the eye strong. And we do that by not wearing glasses, making our eyes work. So if you're already wearing glasses, then what you do is you go half a diopter weaker than what you're used to, and make the eyes work so they can see in the distance and they can see close to, and then they can see in the distance and they see close to. And in parallel with that, never wear shades. Don't wear dark glasses, because that makes the muscles of the iris, it makes them weak too. So that we don't, because we need strong muscles to make the eyeball, the pupil smaller. So the tips, so to prevent your eyes degenerating with age, don't wear glasses, eat a low ketogenic diet, take vitamin C, don't wear shades, and just use your eyes, exercise them. So, don't give up. So if you can't see something instantly, squeeze your eyes tight like that, because squeezing like that, helps to massage the eyes into shape. So I can now read, very tiny writing close to with no problem at all. and have perfect long vision. Now, I did start off wearing glasses for reading in my 40s, and I didn't discover this until I was in my 50s, and I was able to reverse it. And so have many other people reversed and improved their eyesight by attention to these simple exercises.
I'm
Good
taking off
girl.
glasses. Well, that has been the most hopeful and inspiring thing, because I also started wearing them in my 40s. When I started getting blurry up close, and I find that I almost can't function without them now. I can't read without them. So, but this gives me a lot of hope. You've given me a pathway forward.
What also helps with the reading is get a very bright light. What we have is it's called a serious reader light, which I managed to get off eBay for very cheaply, but a very bright light, because that contracts the iris, so the pupil gets smaller, and that has what's called the pinhole camera effect. So that helps the focusing business as well by having that pinhole camera effect. So bright light for reading is an additional bonus. And yep, you'll be able to get rid of those glasses, I guarantee you. And also, by dint of doing that, all these things, it also stops you from getting macular degeneration, glaucoma, and cataracts. I will send you my chapter on this so you can read all about it. And please, it's in Ecological Medicine. So please, send that round to anybody who wishes.
I will. Thank you so much. And thank you again for time and just sharing your wisdom and your pearls. I feel so inspired in your presence, and I'm just really grateful.
My pleasure. Any questions, just send me an email and I will pick up on that.
Will do. And we'll include that. We'll include links for people to get in touch with you and look at your book and things in our show notes.
That would be lovely. I'd be very happy for that to happen.
Dr. Sarah Myhill, everyone. Thank you again. Have a great rest of your day.
And thank you, Kristin.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.